The measles outbreak in southern Ontario has other provinces, states, and health jurisdictions starting to take notice. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington-Dufferin-Guelph. Dr. Mercer, thanks for your time as always.
Oh, thank you for having me.
So we know that this outbreak was mostly driven by the unvaccinated population. I just want to check in on that. Is that still the case to date?
Yeah, absolutely, it's the case. So if we look broadly across our numbers, and by unvaccinated, we mean you've had 0 doses or possibly 1 dose of a measles-containing vaccine, as opposed to you need 2 doses of a measles-containing vaccine. But the vast majority of individuals have either had 0 doses or we have no documentation that they've had any doses, even if they think they may have. We don't have that documentation.
Can you give us an update on the situation locally, an update on the cases in Wellington-Dufferin-Guelph at this time?
Well, that's a really interesting question, because although I can tell you that our number is 12, we have a number of cases that are under investigation, we actually really don't know exactly how many people have had measles, because sometimes we hear anecdotally of families that say, oh yes, last month we all had that. And is that true? It could very well be true. So what we do think, and I think this is quite fair to say across many parts of Ontario, is there's probably more people who've been ill with measles than have actually come to medical attention. And sometimes we only find a family if one member of the family is hospitalized or ends up going to the emergency room. Then we're able to identify that others have been sick. But sometimes people just stay home, recover, go back to work or school, and maybe don't come to medical attention.
Now, the surge in cases in Ontario in recent weeks has prompted a travel advisory from New York State health officials. I just want to get your thoughts on this.
Yeah, this is a really interesting thing. So I would say that they say don't come to Ontario, because we have measles, but I would say the travel advisory should be for everyone out there. If you are unvaccinated, you are, or your children aren't vaccinated, or you've only maybe had 1 dose, you should have your own personal travel advisory, because measles is incredibly easy to get. So you could go to Texas, you could go to parts of Ontario or other provinces, or actually you could go to other countries in the world on holiday. You could go to the Caribbean or someplace for a holiday and come back with measles. So if you are not vaccinated, then you could get measles in many parts of the world, notwithstanding Ontario right now. So I think that you just need to say that you are vulnerable, and you should be very careful where you go if you've chosen to not be vaccinated.
So with, spring and summer travel here upon us, are you recommending people kind of make it a priority to check their vaccination records before taking that trip?
I think this is really important. Measles is nothing to fool around with. People can be very ill, and we do know in Ontario of all the people that have been sick, numbers of them have actually, mostly children, but numbers of them have ended up in hospital, and some have ended up in ICU. So measles is not just a little rash and that you get over. You can be really sick. So your children are eligible for their 2nd dose of the measles vaccine, assuming you've had the 1st dose, at the age of 4. So your 1st dose is given just after your 1st birthday, and your 2nd dose, you're eligible somewhere between 4 and 6. But I think this is a really good time to check your records. If your child has not had that 2nd dose of measles vaccine yet, then please consider going to your healthcare provider and making an appointment to get the 2nd dose. You're eligible for it, so it's not a big deal to get that 2nd dose early. If you are in an at-risk community, or you're visiting at-risk communities on a regular basis, talk to your family doctor, your primary care provider, about maybe having the 2nd dose earlier if you're eligible. I think it's just really important right now. You don't want your children to get measles. It really is not a nice illness, and we have a vaccine that is very effective at keeping you safe.
Okay, well, I'm glad we could get an update from you on the situation, Dr. Mercer. Thank you for your time as always. Dr. Nicola Mercer is the Medical Officer of Health in Wellington-Dufferin-Guelph. Thanks again.
Oh, and thank you for having me.